Hello, I welcome you to our health talk on how to prevent and reverse infectious diseases naturally. This health talk is powered by the Gilead Nature Cure Center. The Gilead Nature Cure Center is a natural health care brand that educates and provides natural solutions to various diseases using diet and nutritional therapy, herbal therapy, detox therapy, and other natural therapies. I am your coach, Dr. Kemi Omoaka. I'm a naturopathic doctor, a dietitian, a healthy living ambassador, a healthy cooking coach. I'm the CEO at the Gilead Nature Cure Center, founder at Food as Medicine Institute. I'm a digital marketing expert, an entrepreneur, a public speaker, trainer, and author. I'm a terrific wife, a mom, and then I'm a Jesus baker. What I do is to help people reverse their health issues naturally. The health, especially the diseases that have been termed incurable by the medical world. That the medical world termed them incurable does not mean there are no other solution out there, especially naturally. The Bible says with God all things are possible. Now the solution to some diseases that have been termed incurable has been provided by God, and He puts them in nature. He created nature, the natural things He gave us. That is where the solutions are, and so many people are going through critical health issues or minor ones just because we have deviated from nature. So let's go back to nature. If you want to be well, if you want to be cured, you have to go back to nature. You may not know how to do that, but that is why we are here. Okay, so once again, you are welcome to our health talk or health webinar on how to prevent and reverse infectious diseases naturally. So what are infectious diseases? Infectious diseases are illnesses caused by harmful organisms. They are also called pathogens that get into your body from the outside world. You can get infectious diseases from other people, from bug bites, and contaminated food, water, or soil. Infectious diseases are a leading cause of death worldwide, particularly in underdeveloped countries, especially in young children. Okay, so worldwide, an estimated 56.2 million people died from all causes in 2001. Almost one-third of these deaths, that is 26.1%, were due to infectious diseases, and virtually all were in developing countries, that is low-income countries, common in Africa. Okay, so out of the 56.2 million people that died in 2001, 26.1% of this total number of people that died were died due to infectious diseases. Okay, and it has been according to research that it was found out that year that 14.2 million out of the 14.7 million, they were from low-income countries in Africa, such as a country like ours. So what are infectious diseases? We are still on that. In 2019, 2 infectious diseases, lower respiratory infections and diarrhea diseases, were ranked in the top 10 in the top 10 causes of death worldwide by WHO. Both of these diseases can be caused by a variety of infectious agents. Now, what are the agents that cause infectious diseases? Infectious diseases can be caused by several different classes of pathogen organisms, commonly called germs. Pathogens that cause infectious diseases are viruses, bacteria, parasites, and fungi. Those are the major things. Almost all of these organisms are microscopic in size, that is, they cannot be seen except you use a microscope, and they are often referred to as microbes or microorganisms. So what's the difference between infectious diseases and non-infectious diseases? Infectious diseases are caused by something. They are caused by harmful organisms that get into our body from the outside world, like viruses, like bacteria. Okay? Now, you can get infectious diseases from other people or by getting a bug bite, like mosquito bites, or from your food, as in you get them from the outside world. Maybe from one person to the other, or from animal bites or bug bites, or from the food or water you ingest. Flu, measles, HIV, COVID-19 are all examples of infectious diseases. Now, non-infectious diseases are usually caused by genetics, unhealthy diet and lifestyle, getting older, old age, and the environment you live in. Although I have a clause when it comes to old age and genetics, because old age is actually not a disease. Old age is actually a paying back time. It's the reaping time. In your younger age you have sown, and it is in your old age that you begin to reap what you have sown while you were younger. So if you sowed diseases into your body by eating junks, it is in your old age you begin to reap them in form of sicknesses and diseases. Okay? Also genetics, yes, that we may be predisposed to have some health challenges because they run in our bloodline. But that your parent has a particular health issue does not mean you must have it. If you prevent by changing your diet and lifestyle, you cannot have it. Inherited diseases is like a loaded gun. Like when you point a gun at someone, the gun is actually pointed at that person. Yes, that is obvious. But nothing will happen until you pull the trigger. You need to pull the trigger before the bullet will go off and into that person. Okay? Likewise it is with inherited diseases. That gun is like the family. The bullets inside the gun, they are like the diseases in that family. Now the trigger, that gun trigger, is likened to your diet, the way you eat, your lifestyle. So that is what will now pull that diseases in your family. That is what will trigger it. If you don't pull the trigger, nothing will happen. You cannot have the diseases that is common in your family if you don't pull the trigger with your diet and lifestyle. But if you are eating junk, you are eating unhealthy diet, of course you will pull the trigger, and the bullet of disease in the family will also get into you. Okay, but that's why you are here, to acquire knowledge, so you can know what to do in order to prevent diseases that run in your family. Okay, but right now we are considering infectious diseases. As time goes on in the course of our weekly health talk, we are going to get to that. Okay, so as I said earlier, infectious diseases are usually caused by genetics, unhealthy diet, getting older, and the environment you live in. You cannot get non-infectious diseases from other people. It is not passed down from one person to the other. I'm not talking of genetics now. I'm not talking of family, the diseases running in the bloodline. But as in, it's not someone that is infecting you. It's not a fellow human being that infects you with non-infectious diseases. They are also called non-communicable diseases. That is, cannot be passed from one person to the other. Like if your parents have high blood pressure, that you stand by them does not mean it will jump into you. No. You understand? It is later, maybe by your diet, even in their absence, that you may have it, but it's not being passed from that person to you. And then non-infectious diseases cannot be gotten by getting a bug bite or from food, as in contaminated food. That's what I meant, or contaminated water. Now, cancer, diabetes, congestive heart failure, and Alzheimer's diseases, and so many others are all examples of non-infectious diseases. 4 major types of infectious diseases. Infectious diseases can be viral, can be bacterial, can be parasitic, or fungal infections. Now, number 1 is viral infections. These are caused by viruses. Examples of diseases caused by viruses are COVID-19, the recent one, influenza, HIV/AIDS, Ebola, hepatitis A, hepatitis B, or hepatitis C. They are all caused by viruses. Another major type of infectious diseases is bacterial infections. These are caused by bacteria. Bacteria are all around us, including inside of our body and on our skin. Many bacteria are actually harmless or even helpful, but certain bacteria release toxins that can make you sick. Diseases caused by bacteria include anthrax, tuberculosis, salmonella, and respiratory and diarrhea diseases. Fungal infections. These are infections caused by fungi. There are many different fungi. They live on and in your body. When your fungi get overgrown, or when harmful fungi get into your body through your mouth, your nose, or a cut in your skin, you can get sick. Now, another major type of infectious diseases is parasitic infections. These type of infections are caused by parasites. Parasites use the bodies of other organisms to live and reproduce. Parasites include worms and some single-celled organisms like protozoa. That is the parasite that causes malaria. What are common infectious diseases? Infectious diseases are extremely common worldwide, but some are more common than others. Some of the most common infectious diseases are listed here by type. Common infectious diseases caused by virus. Now I'm going to list them by type. I gave you the various causes of infectious diseases. You understand the various types, the types of infectious diseases, and we mentioned that there are some caused by viruses, some are caused by bacteria, some are caused by fungi, and some are caused by parasites. Now I want to mention the common infectious diseases based on the category they fall in. Common infectious diseases caused by viruses. We have the common cold, the flu or influenza, COVID-19, stomach flu, hepatitis, respiratory syncytial virus. Now, common infectious diseases caused by bacteria. This includes strep throat, salmonella, tuberculosis, whooping cough, chlamydia, gonorrhea, and other sexually transmitted infections. In fact, we are going to start with sexually transmitted diseases, or let me put it this way, the diseases that are It's the infectious diseases that are usually found around the genital areas, around the reproductive areas of both men and women. So I'm going to I would like to dwell more on that because they are more common these days. Okay, and if time permits, I will also touch other aspects of infectious diseases, but majorly we'll be talking about the ones that are related to our genitals, our reproductive areas. Not all of them are sexually transmitted, please. Some are sexually transmitted, while some other ones are not sexually transmitted. In the course of this health talk, you will get to know about all this. Okay, because there was a situation we had. A couple came to visit us, and then it was actually the wife that wasn't feeling too well. Okay, so when they ran the test, we sent them for a lab test and they brought the result. So when we saw the result, it was infection, and the husband was like surprised that, oh, so you woman, you've been cheating on me. Just the mere fact that he had infection, he believed it was sexually transmitted. Not all infections are sexually transmitted, please. So you need to change your mindset about that. So the man got so angry, so that the wife has been cheating on him, whereas the infection the woman had was not sexually transmitted. It was due to other causes. Okay, so you need knowledge. If not that we calmed down the man, we calmed the man down and educated him and let him know that this is a different case, probably he would have sent his wife out of the he would have sent his wife packing, or probably he would have divorced her. So we need information. Okay, so we are going to dwell more on that aspect. Another infectious disease caused by bacteria is urinary tract infections. It's part of what we are going to be talking about, what we are going to be discussing. E. coli too. E. coli is common among men. Urinary tract infection is common among women. You know, infections that happen in the woman's genitals. And then E. coli is more related to men. So this last 3 here, we are going to be discussing them in the course of our weekly health talk. We are going to be discussing them in details. Okay, so what are the common diseases caused by fungi? We have ringworm, like athletics foot. You know what that means. In between your feet, your toes, it's like there are sores in between your toes. It's caused by ringworm. Fungi nail infection, you know, like whitlow, and then there's another one that is even more serious than whitlow. Fungi nail infection is caused by fungi. Then vaginal candidiasis, that's vaginal yeast infection. Frost, they are all diseases caused by fungi. Alright, so common diseases caused by parasites include giardiasis, toxoplasmosis, hookworms, and pinworms. Who is most at risk for getting infectious diseases? Anyone can get infectious disease. You may be at an increased risk if your immune system is weakened, or if you travel to areas where certain highly transmissible diseases are. People at higher risk of infectious diseases include those with suppressed or compromised immune system, such as those receiving cancer treatments, those living with HIV, those on certain medications, or those following immune destroying diets and lifestyle. Next is young children. Young children are predisposed to having infectious diseases. So let's take care of our children. Let's be careful. Mothers, don't drop your children anywhere. You know, all this child abuse, young girls that are being molested and abused, it's beyond that abuse. Infections are easily transmitted to children who are victims of such. So protect your children, protect your girl child, not only the girl child. Please protect the boys. The boys too are also molested by older women. So let's be careful with our children. Let's not leave our children with just anybody. You may not need to trust that uncle. Don't trust that auntie. Please protect your children, because they are more predisposed to infectious diseases once they are exposed to certain things like abuse, sexual abuse, both boys and girls. And it's always tough on them. It may even affect them in the future. It may result in infertility, because you may not know. Some of these things may not show symptoms until they are now age. They are now of age. Probably they are now in their marital age. Probably in their 20s, and they are getting married. You now get to discover it. It might be too late. Okay, so let's protect our children, please. Those children are vulnerable. They are vulnerable. They are at our mercies. Let's protect them. Pregnant women and adults over 60, they are likely to have infectious diseases too. Those who are unvaccinated against common infectious diseases too. Healthcare workers, people traveling to areas where they may be exposed to mosquitoes that carry pathogens such as malaria, Zika viruses, etc. What complications are associated with infectious diseases? Many infectious diseases resolve without complication. Okay, I repeat, many infectious diseases resolve without complications, but some can cause lasting damage. Serious and life-threatening complications of various infectious diseases include: number one, now I'm going to mention some infectious diseases and the complications that come alongside with them, the complications that they result in if the infections are not treated or if they are not adequately treated. Now, fever, vomiting and diarrhea can lead to dehydration, and dehydration can lead to death. Respiratory illness, viral or bacteria, can lead to pneumonia. Hepatitis B, hepatitis C can lead to liver cancer. So if you have them, please don't joke with them. And if you don't even, and some people even have them, they don't have the symptoms yet, please go for medical checkup, so that if you have these things, you can detect them early and quickly start treating them before they become chronic. Human papilloma virus. Human papilloma virus can cause cervical cancer. Multiple causes, including bacteria, viral, fungal and parasitic infection, can cause meningitis, that is the swelling of the brain. Bacterial infections can cause sepsis. AIDS can cause HIV. So what are the symptoms of infectious diseases? Symptoms of infectious diseases depend on the type of illness. Fungal infections usually cause localized symptoms like rashes and itching. So if you're having rashes and itches, always the infection is caused by a fungus. Viral and bacterial infections can have symptoms in many areas of your body, like fever, chills, congestion, cough, fatigue, that's tiredness, you're always tired, muscle aches and headache. So if you're always having muscle ache, there could be so many causes, but always also consider infection. It could be an infection. Gastrointestinal symptoms like diarrhea, nausea, and vomiting. They are also symptoms that people who have infection do exhibit. It's important to see a doctor if you have a chronic ongoing symptoms or symptoms that get worse over time. You can consult us at the Gilead Nature Cure Center. So we are going to stop here and then we continue in the next video, because I wouldn't want the video to be too long. So we stop here for now and continue in the next video. Thank you.